Hi, Dr. Gibson and Cully here for Snackable Health, and we're talking about artificial sweeteners and your health. What's in the news today?
Mike, it's been so interesting because for the longest time, many of us thought that using artificial sweeteners is a healthy choice. It's an alternative to sugar, which we know, is bad for us and it has that sweet taste. But it's only recently that we've sort of started uncovering some of the science that some of these artificial sweeteners may actually be associated with more harm than good. They may affect our blood pressure. That was a report that came out from the World Health Organization. They may cause inflammation, dysfunction of our blood vessels, and of course, we've also got animal studies that say that they may cause other adverse reactions. So it's nice that we're revisiting this topic, and we have some new data now from the British Medical Journal that's telling us of some of the harms of artificial sweeteners.
And how is this mediated, Pyle? I mean, is it through the microbiome or some direct effect of the artificial sweetener? How does it happen?
It's a great question. We don't know the answer. We know that, like I said, you can have dysfunction of the blood vessels. You can have some changes in the microbiome. We also know that some of this could actually be tracking with other poor lifestyle choices. So, some of the people that use artificial sweeteners also tend to exercise less, tend to have a higher body mass index. They're more likely to smoke, as what came out in this study, and they're less likely to sort of follow a weight loss diet because even psychologically, many of us think that maybe by making that choice, which we think is the healthy choice, we don't need to do the other kind of healthful behaviors that go with it. So we're not entirely sure at this point whether it's a causation, meaning the artificial sweeteners are causing some of these increased signals for risk, or whether it's an association, meaning that it could just be a marker of other lifestyle choices that could be associated with the risk.
Well, they say carbs are the devil, but maybe artificial sweeteners aren't the answer.
They aren't the answer, and in particular, what they found is that aspartame, which is found in Equal and NutraSweet, is associated with an increased risk of stroke, and sucralose, which is found in Splenda, and many of those sugar-free sodas that many of us sometimes drink, the Diet Cokes and such, can increase risk of heart attack. So we're really getting a vascular signal here with blood vessels and such, and so my personal practice and what I tell my patients is that it's best to minimize the dose of those that you're taking. We also know that many regulatory agencies now, because of this new data, are starting to look at whether or not it's time to revise what they say are safe doses of artificial sweeteners.
Wow. Thanks for the update, Pyle.